Dear Chairman, thank you very much for the introduction. I'm Peter Schwarz, Professor for Prevention and Care of Diabetes, and I'm the President of the International Diabetes Federation. I'm very honored to speak here today at the EAEDA meeting, and I would like to highlight some points what are important as President of IDF, but if we are looking into the global diabetes community in terms of prevention. And I hope that I can answer the questions which was given to preventing type 2 diabetes, why, when, and how. Welcome from my side to any one of you. What is important if you're talking about diabetes? And it doesn't matter, are we talking about diabetes care or diabetes prevention? We have to look into these phases and have to accept that people living with diabetes or people living with diabetes risk, they have the right to deserve a better life. As president of the International Diabetes Federation, we just have released the number of people living with diabetes in the world. And for me, this is an indicator about the effectiveness of diabetes prevention. And we are talking about 589 people living with diabetes worldwide. WHO is talking on 14th of November last year about 800 million people living with diabetes on Earth. How can this be that two big organizations talk about different numbers? Under the bottom line, both are right, but they use different criteria. This is also something we have to discuss if you talk about diabetes prevention. But what does this mean? This is an urgent call of action that we have to do something for the prevention of diabetes. And if you ask where we have to do this, it's in low and very low income countries because most of the people are living there. 83% of people living with diabetes come from Bangladesh, Pakistan, India, and China. So this is our target. And the question is how to address this if we really want to talk about prevention. One of the new determinants is seen here. You might think this is the increase in prevalence of diabetes in the future. It is not. It's the conjunction of type 2 diabetes and air pollution. Especially Africa, Southeast Asia, it's a relevant factor. If you stand behind a diesel car, it can be a German nice diesel car, and the engine is running and you take some deep breaths, you find medium-sized particles out of the diesel engine 2 weeks later in your insulin-producing beta cell. You might say sounds very bad, but it's physiologically interesting. We don't know what it makes with diabetes, but in cell culture, we see an impairment of insulin secretion by 30%. So air pollution becomes a new determinant in the development of diabetes and may be relevant for prevention. But the question is, what is the main determinant of diabetes development? Because if we understand this, if we know this, we might be better in preventing diabetes from development. And the answer is very simple. If we fry carbs at a temperature above 130 degrees, you build bonds between glucose and fat, and they are very tight. And we are eating this because it's part of the fried product. And our body cannot break it down because it needs a lot of energy to break down these bonds. So the body is storing it. And where is he storing it? In the liver. And this is MAFLD, this is MASH, this is metabolic associated liver disease. And this is the strongest progenitor for the development of diabetes. So the logic behind there is if we understand this, if we know this, and we really want to prevent diabetes from developing, we have to skip fried products. We have to skip especially fried carbs. And what could be an easy solution? An air fryer, because then you don't consume oil. But even today, there are some people using an air fryer, put oil in it to fry. This makes no sense. But understanding the conjunction between frying carbs and the development of diabetes could help for prevention of diabetes. And prevention could be easy. Walking 10,000 steps a day, as early as possible, you should start with it. This nearly would prevent any disease from developing. I actually would say even if you would eat some fried carbs, but you are physically active, it still would work. It's difficult because you still store fat in the liver, and this impairs the effectiveness of physical activity. Yeah? So having 100 grams of fat in your liver makes you become a non-responder to physical activity. But still, physical activity is the strongest actor to prevent diabetes from developing. And we see it here in people living with diabetes. If they only walk 1,000 steps more than they normally do, it lowers the postprandial blood sugar by 1.5 millimole. So this is twice as much as 1,000 milligram of metformin are doing. So if you have diabetes, the physical activity keeps your blood sugar down. It's not tackling the root of diabetes because the root is the fat in the liver. Diabetes helps to tackle the visceral fat depot, but not the fat in the liver. So this means we are coming to the pathophysiology, and the understanding pathophysiology is important if you want to prevent diabetes. This is healthy. Yeah, look, young women, high normal A1C, eating a lot of carbs, the green arrows, but she has a very flat glucose curve. This is someone who's very insulin sensitive. She needs 1% of the insulin to regulate blood sugar. But here's her father, 50% the same genetic background. The father is actually having a better A1C than the daughter, but you see these fluctuations. And these fluctuations are an indicator of severe insulin resistance. So the father needs about 80% of the insulin the pancreas can produce to regulate blood sugar. The daughter needs only 1%. So this is the big physiological difference between two people, even if the father having a better A1C. And today we know that this fluctuation of glucose is the earliest indicator of morbidity and mortality of diabetes patients. So imagine two people, both have an A1C of 7. One has mild fluctuation, the other one has big one. The one with the big one will die because of a stroke and a heart attack. So having this in mind means we should do whatever we can do for prevention of diabetes by reducing the fluctuation of the amplitude of glucose excursion. The problem is we don't find these people today because we need a sensor for this, and the sensors are still expensive. But in 3 years from now, we will have sensors from $1 for 2 weeks, and this will disruptively change our ways of doing diabetes care and prevention. But the logic behind is lowering the amplitude of glucose excursion is relevant for diabetes and for diabetes prevention, probably for prevention even more than later on. So keep this in mind, because part of the question today was also why and how. Looking into the physiology of diabetes development, again, you see the development of hyperglycemia. The blue curve is the insulin resistance. So the daughter I have shown you is in the beginning here. The father is about here. And all of this is triggered by visceral obesity. But there's a new player, and this is the hepatic fat. I mentioned already the fried carbs. And you see here, it's about in the stage of the father. The liver fat accumulates and then continuously is going up. And I would say the visceral fat is making us sick, but the hepatic fat is killing us because it's a determinant for the fast progression of chronic diseases. Here diabetes starts, and here we diagnose diabetes. Why I'm showing this? Because my argument is we have to act in this physiological red paradigm, because here we have the ability to lead to a remission of the physiological stage, finally leading to diabetes. And this, for me, is prevention of diabetes. And we have to prevent diabetes in the interplay between visceral fat and hepatic fat. And if I ask you, how can we get the visceral fat away? It's physical activity, physical activity, physical activity. But I also already said, if you have 100 grams of fat in the liver, the physical activity doesn't work anymore. You walk 10,000 steps a day and it works like 2,000 steps. This would mean to have the same effect like a liver fat-free person, you would have to walk about 40 to 50,000 steps a day, which is for most of the people impossible. So what can we do? How can we make the liver fat disappearing? And the answer is fasting. If you fast for 2 weeks without eating anything, yes, 2 weeks, not eating anything, drinking water, not eating anything a day, not at night, so total fasting for 2 weeks, you make your liver fat totally disappearing. In my eyes, this is one of the most promising, most innovative messages in diabetes care, because a prolonged ketosis by the release of glucagon can break down fat in the liver and in the pancreas and lead to a remission of diabetes. And this was shown by Taylor. I apologize for the German language here. But if you have fat in the liver, you also have it in the pancreas, and this destroys beta cell function. If you remove the fat of the liver, also in the pancreas, it restores beta cell function and may lead to a remission of diabetes. Remission of diabetes. This is cool information because now imagine you have 1,000 people with type 2 diabetes in your environment, and you could lead to 40 to 50% of them to a remission of diabetes by fasting. This would be a dream. Yeah. In my eyes, fasting is one time, 2 weeks fasting has the same effect like 3 year therapy with Monjaro or Ozempic. And I think this is, it's absolutely worth to use it for our patient. But we also have to understand where is this coming from? And if I would be in front of you, I would ask you who is drinking Coca-Cola, and then who is drinking Diet Coke. And to those with Diet Coke, I would say it's better to stop this. There are 380,000 patient years on this slide. And it shows you if you drink one soft drink per day for the period of 1 year, what it does with your diabetes risk. Water is not increasing your diabetes risk. Normal soft drinks, 40% like a Coca-Cola is doing, but the Diet Coke or Coke Zero is doing 60% increase of diabetes risk per year. How can this be? That the Coke without sugar is doing or making more diabetes than the Coke with sugar? And the answer are the artificial sweetener. And they change your microbiome. And you see here, you have a person who is physically active and then is eating a lot of artificial sweetener. This changes the microbiome. And this bacteria in the gut, so the changed microbiome bacteria, they produce metabolites. And these metabolites are a protein built onto a fatty acid with a very strong bond. It's basically the stool of this bacteria in our gut. And of course, we incorporate this into our body and it's getting stored, you know the answer, in the liver. And this then makes you becoming a non-responder to physical activity. So we believe with artificial sweetener, because they don't contain energy, we do something good for us, but the opposite happens. But there are opportunities. And actually, the situation for prevention of diabetes is getting better and better. Yeah? Smart health, digitalization will be a brilliant opportunity. Here, looking how our drugs lower A1C, how lifestyle is lowering A1C, and how digital tools are lowering A1C. Young digital tools are very effective in lowering A1C. And how can we explain this? That the digital tool, at the end, a smartphone-based app is lowering A1C. And the answer is very simple. We are in the pocket of our patients. We never have been so close to our patient than being in the pocket. Every one of us is taking 1,800 decisions a day. 450 are related to our lifestyle. Now imagine in the right moment, with the right motivational motif, with the right content, we set impulses to influence only 10 out of the 450 decisions a day. But do this over the period of 1 year. We might translate this to 10 kilograms of weight reduction. So digitalization in the pocket of the patient can be a very powerful tool for diabetes prevention. So in my eyes, the modern diabetology or prevention will look like this. And there are examples here in Germany, one app where you use AI to make a photo of your food, and this is quantified and qualified, and then the information is used to help you to make a more healthier next meal, or a Swedish development using a sensor, and then giving very clear recommendation about treatment and physical activity and dietary habits based on the shape of the sensor curve, so to reduce the fluctuation. And this app is basically diabetology out of the pocket of the patient, because it tells you exactly, for example, today, 6:35, you should inject 22 units of long-acting insulin. And then it's tracking whether the patient is doing it. It improves adherence and self-management of the patient significantly by the use of AI and analyzing the shape of the glucose curve with 1,440 measurements per day. Let me come back in terms of prevention of diabetes to the fasting again. We all know that eating less is healthy. Maybe we can say eating nothing is even more healthy. at least for 2 weeks, not to eat anything. You will, if you stop eating, glucose is going down, insulin is going down. This triggers a glucagon release after 12 hours. And this glucagon breaks down the glycogen in the liver to keep the glucose level up. And this is over after 3-4 days. So what then? Then the cool part is the same hormone, also glucagon, has the ability to break down protein to make glucose out of it, or to break down fat to make ketones out of it. So if you fast and you lay in bed, it's breaking down proteins, so breaking down muscles. And this is bad. This increases your cardiovascular risk. But if you are fasting and you're physically active, the muscle which is used is not broken down. So you protect your muscle by physical activity, and then the glucagon is triggered to break down fat to make ketones out of it. So you run into ketosis. And where is glucagon present? In the pancreas, in the liver. That's why these two organs are first freed from fat. And it's tackling the roots of the development of diabetes. And if you are in a total ketosis for 24 hours, you break down about 20 to 25 grams fat in the liver and in the pancreas. This is a very good message. So you can count when the liver fat is gone. And after 2 weeks of fasting, so 10 days of total ketosis, because you need about 4 days to go into the ketosis, then about 200 to 250 grams of fat is gone. This is cool message for the prevention of diabetes. You have a total reset of your microbiome. This is also a very good add-on. Here you see MRI spectroscopy, and the cloudy stuff in the liver is the fat. This is before the fasting, and this is after the fasting. I think this is very clear that it has a good effect in tackling the roots of diabetes development. The International Diabetes Federation is just working on a guideline on fasting and diabetes, and this is the proposal for the water diet for 2 weeks, which is written, or it's in the proposal, and 120 experts worldwide are working on it. I mentioned already this group. This group is addressing 19 different styles of fasting, and Mohamed Hassanain and Daniela Koppold are leading this group, and this will be a blockbuster coming out in the Congress in 27 in Qatar, in a guideline, an international guideline for fasting and diabetes. There is in Egypt a group working on prevention of obesity and diabetes in adolescents, led by Ines Schaltut, and they just have released an IDF campaign. There's also a group of type 5 diabetes working. Type 5 diabetes is a neglected kind of disease related to malnutrition, maternal malnutrition, and the offspring having a lower beta cell mass. And this will also be very interesting for prevention, because this is a kind of diabetes which is very common in Africa and Southeast Asia. Another group working on type 4 diabetes, diagnosis and prevention of gestational diabetes. Ahmed Day is leading a group in AI and diabetes care, and I think using digital media and AI in the future will disruptively improve our ability to do prevention for people with diabetes risk. And Dr. Amit Gupta is the new dean of the IDF School of Diabetes, and this school will have a professional training program, but also a layperson education program for the prevention of diabetes. Together with WHO, we try to address one of the first slides I have shown you, the discrepancy in number of people living with diabetes. And we will address the diagnostic criteria for pre-diabetes and diabetes, because the problem is the different diagnostic criteria we have today, they overlap in Europe and North America very well, but not in Southeast Asia. And you may know there's a discussion about the 1-hour glucose as a new diagnostic parameter for pre-diabetes and diabetes. In a few months, we will have answers in a new guideline and new diagnostic standards there as well. Coming back to the initial question, preventing type 2 diabetes, why? Because we can tackle the roots of the development of diabetes. When? As early as possible. Don't wait that someone has a risk factor. Fasting and physical activity are the right, appropriate manners or matters to do as early as possible. And how? I already said it. The combination of physical activity and fasting, together with a follow-up with a healthy diet, is the best way to prevent diabetes and other chronic diseases from developing. As president of IDF, I have three goals: to be in the brain of every health politician, in the pocket of every patient, and in the heart of every healthcare professional. So every one of you, first, we will develop a diabetes index, a global diabetes index, and this will be released every year by asking 100,000 patient and healthcare professionals everywhere in the world, every country in the world, translate this into an index, and 1 month before World Diabetes Day will be released totally for free. And this index might build a momentum to encourage politicians to act. Secondly, being in the pocket of every patient, of course, you can imagine free digital diabetes education using an IDF-related app, um, so that the patient in Congo can have the ability, if they don't have money to go to a physician or a pharmacist, but they get diabetes education for free on their phone. And finally, the IDF fellowship program. Every one of you is invited to participate, becoming fellow of IDF, and build together a community of enthusiastic and passionate actors to build a global momentum to improve the quality of diabetes care. I invite you to follow any one of these channels on LinkedIn or on Instagram, where I'm reporting about the activities related to the International Diabetes Federation, and invite you to participate also on a WhatsApp channel. And don't forget, for the prevention of diabetes, the faces of these people living with diabetes, because at the end, this is our driver to make a difference, and for people living with diabetes, to make a difference for the prevention of diabetes. Because what we want to do together with our ideas, our enthusiasm to help our patients, to help our people living with risk factors of diabetes to walk away from diabetes. Thank you very much, Shukran. Thank you very much for your attention.